You're listening to 105.9 The Region. Welcome to Health is Wealth with Dr. Mike. I'm station manager Tina Cortez, and my co-host is Dr. Mike Carrozza. Good morning, Dr. Mike. Here we are in the middle of Easter and Passover weekend, and I would guess that most people are doing things differently these days, including us. We are practicing physical distancing, and you're recording from your home studio these days.
Absolutely, Tina, and we hope that everybody's safe, and for sure, I'm happy that we're able to do this still from my studio at home, and obviously keeping up the practicing of washing our hands and social distancing, and of course keeping connected with most people in our families using things like I realize that a lot of people are using things like Skype and Zoom and FaceTime, which is wonderful. So. Especially it's really challenging right now, and I think which is a really good topic for this show is things are a little different. Not only are we communicating with people on different platforms in a virtual sense, of course, but there's even something that I want to talk about to our listeners regarding the medical field. So joining us this morning from the West Coast is Dr. Sam Hamza. He's the CEO of CloudMD. Dr. Hamza, welcome to Health is Wealth.
Well, thank you for having me.
Well, thank you for doing this. I know that these are trying times for all, and right now this idea of in terms of what we're doing virtually, from communicating amongst our loved ones to even working remotely, and now of course patients need support. They need medical help. And, I'd like you to tell our listeners about CloudMD and what it is.
Sure. No, thank you. So CloudMD, we're a publicly listed company, but we are really about changing the way healthcare is delivered in Canada. Historically, it's been very inefficient. It's been very doctor-centric and clinic-centric. And because of lack of access of care over the years and the aging population, it's been really hard for patients to find family doctors or find clinics that are open, and without that central care, that family doctor or that clinic that's open, you can't get anything else. You can't get prescriptions, you can't get referrals, you can't get lab recs. And so the lack of access of care has been hurting patients over the years and costing the system a lot of money as they end up in emergency or with complications. So our whole premise as a company is to change it and make it more convenient, engage the patient, involve them in their own health care, and by using technology, basically. So that's what we are about, is using technology to make it very patient-centric and have an app in the patient's hand where they can connect with their whole health team and at any time from home or from work.
And is this a free app, Dr. Hamza?
Yeah, that's exactly it. It's a free app. So CloudMD is available in the App Store and the Google Store, or online on the website at cloudmd.ca. And the key thing that we always believed in is it should be very low barrier. There are companies out there that charge patients to see the doctor and so on. We really want to focus on making it free. And so it's free to download. It's free to see the doctor as many times as you want or as you need it. And in BC and now in Ontario. And because of coronavirus, if there's anything good that comes out of this, is that it's kicked the regulation up quite a few years in Canada. So now every province pretty much has telemedicine codes, and so it should be and it will be free across the country eventually. So right now we're in BC and Ontario, so we're covering about 20 million patients right now, and it's absolutely free.
Wow. And you mentioned about, Ontario announced an emergency telemedicine billing code. You mentioned this, just for our listeners, for some of the individuals that don't understand what this means. Can you just explain a little bit?
Yeah, no, sure. So when you go to your doctor right now, if you're in Ontario, you're using OHIP basically. So when you go see your doctor sees you, but he doesn't charge you. He or she doesn't charge you, at the front or anything. It's covered by your provincial government billing.
So like when you go, when you go into a walk-in clinic, right? You have to present your health card. Okay.
Exactly. Yeah. So you just present your health card, and it's covered by the provincial plan. And so, historically, telemedicine hasn't been in Ontario. It's been in BC for over 5 years now covered. But in Ontario, it wasn't really covered the same way until recently because of this pandemic. They've opened it up quite a bit, and now it's available for kind of all family doctors to see patients and continue care. And I don't think there's any going back. Honestly, it's one of those things where everybody notices and realizes how useful this is, how important this is for patient care. A lot of times it's very inefficient for us to ask patients to come, take a day off of work and cross town and sit in the waiting room for an hour and a half for a 5 or 10 minute appointment. That's extremely inefficient for everybody, and it puts a lot of strain on the system. And the doctors running off, trying to see all their patients in the waiting room a lot of times when they could have just called or used the telemedicine to review a test result or to give a prescription refill. And that's really what this is about, is the future of healthcare being pushed into the forefront right now because of what's happening.
And not to mention, and obviously we've all been in the situation, and I'm sure for our listeners, is going into a walk-in clinic. I mean, some of these busy walk-in clinics, especially, before they started or before March break, you got maybe 20 people in this room, and some of these individuals could be actually carrying a virus of some sort, right? So, not to mention that this whole thing can be avoided.
Exactly, and so that's actually why it's part of the pandemic planning. So if you actually look at the WHO or CDC and you hear Trump talking all the time about telemedicine, it's actually part of the planning. So pandemic planning goes from trying to contain the virus wherever it is initially to mitigation, and part of mitigation phase is to tell people don't go to the clinic or to emergency if you're sick, or anytime really, because what you're doing if you do that is you're either going to get it, you're going to give it, or you're going to strain the system where they need to be used for people who really need to be there. And so part of the mitigation phase is actually telemedicine. It's actually built into that. And so everybody kind of scrambled real quickly in North America because they weren't set up for it. We've been prepared for this for quite a while, kind of in our own clinics in British Columbia and so on. But even as a company, we were able to scramble real quickly and even offer our standalone telemedicine product to North American doctors for free for the next 30 days to do telemedicine with their own patients, because again, a lot of them scrambled to find something secure, and many were using things like FaceTime and Skype, which is not secure and really shouldn't be used. So we were trying to help out on that aspect of it as well. But yeah, you're right. Absolutely, it's one of those things where things are changing, and it's available now.
And it's almost like the new normal, right?
And that's exactly it. That's a great way of putting it. It is the new normal. Even we're talking about healthcare right now, but for anything. We talked about kids in the break. Kids, with education and so on, using virtual education and working from home for us, that's going to be a new normal as well. We're implementing it in our own practices, even in the clinics. We're saying that it's going to be a hybrid model where you might work in the clinics for 2-3 days and then you work from home a couple of days a week, and that just makes it more efficient. It's much better. It makes it more convenient for everybody. You go to the clinic to see people who really need to be in the clinic, and you work from home for things that can be done from home. And I think that's going to be new normal for everybody. And so I think this has changed. Like, the hardest thing in life is to change behavior, right?
For sure.
And this has changed behavior on every aspect of life, whether it's the patient, the doctor, or even the government. And I think this is, going from Blockbuster to Netflix kind of change very dramatically.
Very dramatically. Now, can you just, before we end off, I just would like to, and Tina, I think this is going to be useful for our listeners as well. Just, can you go through, so obviously, pharmacies are now even just drop shipping. So, I can understand the virtual, just for our listeners, obviously, if they have a concern with their family doctor, maybe they're going through something, whether it's a concern, but, obviously, with this amazing virtual, there's still going to be some kind of human interaction, I guess, with especially labs. And can you just go through some of this? If the ordering physician needs to see some kind of blood work on the individual, would they have to still go into a laboratory, or is there some kind of home service that's getting offered? I don't know what's going on down in BC. Can you just elaborate on that?
Yeah, no, it's still the same as before, but we can e-fax things. So from our system, so one thing that kind of separates us is that we're not really a virtual walk-in clinic. We're a virtual family practice.
Family practice.
Yeah. So what we do is we create a chart. It's created immediately, actually. So as soon as you sign up in our system, as long as once you download the app and you register, it actually creates a chart that's continuous with you and follows you no matter who you see in our team. Whether it's the doctors, the nurses, we're adding counseling services and specialist services and so on. So it's all about continuity of care. But we can e-fax labs to the lab for you, lab recs to the lab, so you can just go to the lab and get blood if you need it. And a lot of labs now you can do appointments even, so that you can even limit your time that you're there. So you can book an appointment, you can go there, get it done right away if you need to.
Yeah.
And prescriptions, we e-fax prescriptions right to the pharmacy of your choice, and we're talking to pharmacies right now to do home delivery as well.
Yeah.
So that way we can get it home delivered to you, so you don't have to leave or take your kids with you or so on.
Wonderful. Well, and then another thing, I think you've noticed an increase, right? What do you have like a percentage of the people that have been using this ever since this coronavirus sort of came through? Like, have you noticed an increase?
It's been dramatic for sure. We just announced this morning that we have over 100,000 patients on our platform now across Canada, and I think in just the last 2 weeks we've had about 10,000 downloads. We just launched in Ontario last week, and so we're just trying to get the word out in Ontario that, hey, this is free. It's not like other services that you might have been familiar with for the last year or two, where you had to pay $50 or $70 for it. We believe in this being part of your regular health care. We're a team-based approach. We're not replacing your family doctor if you have one. We're trying to help. And that's really our focus, is that this is created by doctors for patients. And so we're a little bit, trying to be part of the healthcare team and solution here.
And innovative for sure, and wonderful. So the availability is 7 days a week, I believe, correct?
That's right, absolutely.
And so, like, what are the times? Is it like Monday to Friday? Is there Saturdays and Sundays as well, or?
Yeah, no, absolutely. 7 days a week. It's 9 to 7 right now. It's 9 to 7 during the week, and on the weekends it's 9 to 5. Wow. We will be expanding that. So eventually, what we're looking for is eventually to have 24/7. If over the next year or so, we will make it so that it's something where there's time shifting and it's 24/7 for patients, so that you don't have to go to emergency if you want to ask a question, at nighttime, or you need something done. We're trying to help the system, and with technology and with shared resources and scale, you can do that. You can't do that as an individual clinic, but you can do that as a company that uses scale and trying to share resources and so on.
Oh, wonderful. Wonderful. Dr. Hamza, thank you very much for coming on the show. I just would like to, if listeners want to connect and want to learn more, where can they reach you?
Yeah, no, absolutely. So as we mentioned before, the app is available in the App Store for free, and you can download it. You can make an appointment anytime and see a doctor. But you can also go to our website at cloudmd.ca, and there's a lot more information there. If you want to send an email, it can be at info@cloudmd.ca.
Wonderful. Well, thanks again for doing this, and stay safe and healthy.
Thank you. You too.
Dr. Mike, over to you.
Joining us next on the show is television personality Grego Mineault. She's wonderful. If you don't follow her on Instagram, she's a wonderful human being, and she's full of energy, and she's on our show today. Grego, welcome.
Thank you so much for having me, Dr. Mike. Thank you.
Grego, listen, obviously you're quite, we've done some work together in the past, but I mean, you've got great energy. We're seeing your activity on Instagram. You incorporate your family, cooking, lifestyle. Like, what motivates you, especially during these times? I mean, I think, you can maybe give a nice little motivation to a lot of our listeners.
Yes, well, we try to stay positive. We try to be busy. We try to stay creative, and I'm, savoring every moment spent, with my family right now, and we really try to make the best out of this situation. So, these are difficult times, and it's hard for everyone. But, as I said, we have to try to stay positive. So, I cook a lot at home with the kids. We play a lot of board games. We clean a lot. Last 2 weeks ago, we did a little Spanish Mexican theme at home, and I cooked some Mexican dishes. We dressed up. I put some Gypsy King music, and we danced in the kitchen, and the kids loved it. Last week, I did a French theme, so we drew a giant Eiffel Tower and put it up in our backyard. We dressed up with some French music, and we had a little déjeuner at the foot of the Eiffel Tower, and it was nice, and the kids loved it, and they enjoyed that, and it's nice to do this as a family as well.
Well, that's beautiful, and I think that's the spirit, really. I mean, when you take advantage of spending time at home with your family, I mean, you can either sit on the couch and do nothing and watch movies, or you can sort of, dance the night away as you are. And I think your background is dancing, right, Grego?
Yes, I study ballet in Montreal.
So music and dancing is a big part of your life.
Dancing is a big part of my life. We dance a lot in my house. We dance a lot in the kitchen. I always have some music on, especially when I'm cooking. I love to put some music. My husband loves music. The kids too. So and especially now, we need to be surrounded by things that we love and put a smile on our face. So music is a big part of.
Absolutely. And just from the health standpoint, I mean, because most people, instead of staying on the couch and sort of laying around, that getting up and doing I know we do this as well, Grego. That's why I love the energy, is that we have dance parties pretty much definitely a couple times a week. And what it does is it stimulates the lymphatic system, which is, the lymphatic system is basically your system which could send off and prime your immune system. So by dancing and moving your body and your muscles, it gets you to move around, and so you can really get your body and all the fluid juices flowing and really keep yourself healthy, right?
Right. Yeah, I love that.
and I think that's the key, right? And then not to mention, what comes along with that is being happy and being in the moment.
Very true.
And so while our listeners obviously may recognize your name from television, you're cooking up something, and you have a new project, no pun intended, tell us about that. It's just YouTube, it's a kitchen party, right?
Yes, so I have a YouTube show on my YouTube channel. It's called Kitchen Party with Grego and Ada. We filmed 7 episodes that you can actually see now online, and the format of the show, it's me and my co-host Ada. We cook. We have every show is different. We have a different guest, and we use a different kitchen for every episode, and we film in front of a live audience. We have it's a big party. So it's basically what we have. Your home, my home, and it was in my home. I love to cook and dance. And I entertain a lot, so it's gonna have, it's like what's happening in my kitchen. So we do a little recipe together, and it's all about the guests, and it's really fun. So far, it's doing very well. So I'm really happy about that.
Wonderful. So you already have a few episodes, and I think you're still going to be obviously, once things settle down, you'll do some more.
Yes. That's what we want. That's the plan.
Yes. I mean, and during these times, I follow you on Instagram, and again, I think our listeners definitely need to follow you. But, I mean,
thank you.
Yeah, you encompass the family time more than I think anybody else I follow, and I love it. And what comes along with that is great food, healthy ingredients. But when you cook, you cook with intention. I mean, you have intention when you cook, right? Like you make a little bit of a larger meals. You use a lot of good antioxidants and really healthy ingredients, but you cook a lot, right? And you save it for like the next day to just sort of...
I do. I usually, when I cook, I always cook more so I can have, leftovers for the next day. And yeah, so I use simple ingredients, but, quality ingredients, and I try as much as, and by the way, I love to cook with, I don't usually cook with a recipe. I like to create a dish. I like to cook with leftovers. That's what I love doing. But yeah, I like to involve the kids with my cooking, especially now that we are, all home. So, and they love it too. So yeah, but cooking is a big part of our daily routine for sure.
And then the kids can practice as well. I mean, and you're teaching them a pretty good life skill, right?
Yeah, that's true. That's actually later today I have lots of bananas left that I put in the freezer. So and I don't bake much, but I'm gonna try to make some chocolate chip banana cupcakes with the kids later this afternoon.
I love that. I love that you always incorporate it of some sort and definitely some truth. But you're utilizing what you have. I think I watched one of your videos, and right now, all of us at home, whether we're getting groceries or we're just waiting for that 1 or 2 week fill, maybe we're getting groceries delivered. It's really challenging to go to the grocery store. But let's say you have a can of beans, or you have a pack of pasta. I mean, you can definitely create something from nothing, right?
Of course, yeah. We definitely try to avoid as much as possible going to the grocery shopping. So I'm using everything that's in my, left in my fridge or pantry. And yeah, you can create something with a can of bean or canned tomatoes and pasta, or leftovers veggies, or garlic, onion. You can create like a nice dish, a big dish. So definitely.
And so, I mean, so you recreate. I think the key is that, let's say if somebody makes something and makes a big pot of something, I mean, recreating it, reconstituting it to make it taste a little different for the next day is a good idea as well.
Yeah, yeah.
Well, that's wonderful. And the other thing I want to talk to you about is later tonight, I think you're having some kind of a party with the Living Lux magazine. Is that correct?
Yes. I'll be live at 8 p.m. on the Living Lux magazine Instagram. It's going to be Instagram live on their handle, and so they feature our recipes from our our YouTube show. So I'm going to be talking with Jennifer Litkowitz tonight, and we're going to have a glass of wine, and we're basically just going to talk about our quarantine life, and
the new norm.
The new norm, yeah. So tune in tonight at 8 p.m. on Living Lux magazine.
That's great, and then you're going to talk about some nice recipes. I love your recipes, by the way. I think they're all great, and it's definitely Dr. Mike approved. Because
Yay! Well, you have to share a few of your family recipes as well, Mike, because I know you cook a lot too, no? Yeah,
I do. I have to admit, I use a lot of whole ingredients, and especially, I think the big thing that we're buying a lot of, especially, are the staples like garlic and onions. I think it's really important. There's a lot of minerals in there, and of course, the microbial activity alone, just by having them in your body, is going to help you fight and keep your immune system nice and strong, right?
Well, I use a lot of garlic in in my cooking, lots of garlic. I love garlic and onions too. So, this is something you always need to have in your pantry. Garlic, onions.
Yeah, garlic and onions. And I think canned food really goes a long way, right, too, Grego? I think, and it's sometimes, obviously, we don't know, and even the frozen beans and the frozen vegetables, I'd encourage some people to look at these as well, because we can do a lot with frozen broccoli, frozen green beans.
Very true. Especially now, we with everything that's happening with frozen vegetables, there's a lot you can do. And I always have in my pantry the San Marzano tomato cans. And
yes.
You can do a lot with that. Lots
Yes.
of sauce, different sauce. You can do a lot of, so I recommend, like, to, get few of those cans and you'll be fine.
Yeah, for sure. You can make different chilies. Thank you. So where can people connect with you, Grego?
So, yes, on my Instagram, so it's at Grego Mino. That's my Instagram handle. Facebook is Grego Mino. And my YouTube channel, it's Kitchen Party with Grego and Ada.
Oh, beautiful.
It will get better, so we have to, stay positive.
It definitely will. It definitely will. Well, thank you very much for doing this, and thank you for your energy, your support, and we look forward to seeing you soon. And stay safe and healthy with you and the family.
Thank you so much, Dr. Mike, and stay safe and healthy as well.
Thank you.
And your family. Bye-bye. Have a nice afternoon.
Yeah, you too.
Well, it's been great just absorbing the energy of the two of you. And just before we wrap up the show, Dr. Mike, if our listeners want to connect with you, how can they do that?
Well, please call us at the 905-417-4000. We're here to support everybody during these difficult times. They can email us as well at info@applemed.ca. They can send us messages on Instagram as well at AppleMed Clinic. And for everybody out there and for all our frontline staff and everybody out in the trenches, just thank you very much for everybody, for all their hard work out there, the nurses, the staff, the grocery clerks, the pharmacists, and thank you, and just want to make sure that everybody is safe and healthy.
That's our show for this week. If you missed any part of Health is Wealth, go to our website, 1059theregion.com. Thanks for listening.